I recognize the Leader of the Opposition.
Mr. Speaker, this tired and out-of-touch government isn't focused on the things that matter to Saskatchewan people. They're not focused on the cost of living, they're not focused on our kids' classrooms, and they're not focused on the problems in health care. Mr. Speaker, with us today are occupational therapists. They're calling for action to address the dire shortage of these important health care professionals in our province. Will the Premier also meet with them today to understand their concerns and their proposed solutions?
Recognize the Premier.
Certainly, Mr. Speaker, with respect to occupational care that is offered across this province, Mr. Speaker, it's a care that's of increasing importance, and I think is most certainly expanding, both in the numbers of folks that we need to attract into our Saskatchewan Health Authority and the communities across the province to offer this ever so important service, not only to adults, Mr. Speaker, but also to our children. That's why the Minister of Advanced Education has been working with our health ministers, Mr. Speaker, to expand the number of seats that we have available, reserved for Saskatchewan residents, Mr. Speaker. Those are currently in Alberta, yes, Mr. Speaker. That's also why the Minister of Advanced Education has engaged the University of Saskatchewan as to, how can we begin that program right here in Saskatchewan, Mr. Speaker, understanding the need, an increased need in years ahead, Mr. Speaker, and making that program more available and accessible to Saskatchewan, young people in Saskatchewan, Mr. Speaker, that want to enter the profession.
Recognize the Leader of the Opposition.
Mr. Speaker, I do hope that the Premier does take the meeting, because I think that there is some information that he needs to hear. Occupational therapists, Mr. Speaker, are a vital part of the healthcare team, but like so many others in this province, they don't have the staff that they need to be able to offer the care that people need. Again, in your gallery today is a delegation of occupational therapists and others that are deeply concerned about the state of their profession in this province. When it comes to occupational therapists in Canada, by province, Saskatchewan is dead last in Canada. What's the Premier's plan to end the shortage of OTs in our province today?
Recognize the Premier.
Because recruiting, retaining, training occupational therapists, Mr. Speaker, alongside many other healthcare professionals that we need to attract into our system here in Saskatchewan, to make their home in our communities here in Saskatchewan, Mr. Speaker, is a paramount effort of both of the Ministers of Health and all of the associated ministers, such as, in this case, the Minister of Advanced Education, Mr. Speaker, in ambitiously looking at how can we expand the number of training seats that are available for our youth or anyone that would like to enter the field of occupational therapy, Mr. Speaker, and how can we bring those training seats closer to Saskatchewan people, Mr. Speaker, making them more accessible. And so with one of the most ambitious health human resource efforts in the nation, Mr. Speaker, working alongside our other 10 provinces and 3 territories, Mr. Speaker, we continue to work on attracting, retaining, incentivizing not only occupational therapists to work in a community in Saskatchewan with our Saskatchewan Health Authority, Mr. Speaker, but all of the health professionals that we need in order to ensure that we're able to offer the services that Saskatchewan people expect.
Recognize the Leader of the Opposition.
Mr. Speaker, I believe that the Premier alluded to it, but clearly the folks who are here today want to see a school for occupational therapy here in Saskatchewan. They want a plan. They want Saskatchewan people to be able to learn their profession here so that they can provide care to people here in this province. Mr. Speaker, this is not the time for a plan to make a plan. The situation is critical. Again, the lowest per capita amongst provinces in Canada. This could be part of a grow-your-own plan to get our healthcare system back on track and to fix chronic short-staffing in this province. Will the Premier listen to the occupational therapists here today, and will he agree to an occupational therapy school here in Saskatchewan?
Recognize the Premier.
Speaker. This is an important discussion to have. Mr. Speaker, and I agree, it is not time to make a plan that at some point in the future might plan to solve the challenge that we have, Mr. Speaker. That's why the Minister of Advanced Education has moved swiftly to increase the training seats that we have access to, that Saskatchewan people have access to, by 10 to a total of 50 over the 2 years of training, Mr. Speaker. And that's why he's engaged the University of Saskatchewan, Mr. Speaker, on do they have the space within the College of Medicine, do they have the faculty that can ultimately offer this training right here in a Saskatchewan community for Saskatchewan residents, so that at the end of their training, Mr. Speaker, they could stay in a community right here in Saskatchewan, offer those services to Saskatchewan people, services I would say that Saskatchewan people expect to be able to have access in their community. So this is a government that is committed, Mr. Speaker, to having those training seats, working with our post-secondary institutes, Mr. Speaker, to bring those training seats closer to Saskatchewan and ultimately at the University of Saskatchewan.
Recognize a member from South Prairie.
Taking it seriously means taking action, Mr. Speaker.
That's right.
Changing the screening age is one simple step that government could take to improve patient care. They also need to increase the number of mammograms that are happening in the province. The annual report for the Saskatchewan Cancer Agency shows that the number of mammograms done each year is down by 10,000 scans. It's completely unacceptable. Early detection is essential for breast cancer patients. What is the minister's plan to increase this important access to breast cancer screening in Saskatchewan?
Recognize the Premier.
Speaker, I'd just like to inform all of those that have been touched by any type of cancer, but in particular in this case breast cancer, Mr. Speaker, which are many, many families across the province of Saskatchewan, Mr. Speaker, and including my own and so many others in this House here today. And I'd just like to inform everyone as to the instruction from the entirety of caucus that our health ministers have received, and that is in addition to the 8 locations that we currently provide mammography services and the over 40 communities that our mobile units visit, Mr. Speaker, is to look very closely at how we can expand that capacity with an eye to eventually moving that age limit down. If we were to move that age limit down from 50 to 40, it's my understanding it would be about 70,000 women that would be eligible for those early detection services, Mr. Speaker. We want to ensure that if we are to make that decision as a government, Mr. Speaker, and I think it's fair to say that that is our goal, is to make that decision, that we have the services in place so that those 70,000 women would be able to access the service, Mr. Speaker. And so that is the discussion that the government caucus has had. That's the instruction from the government caucus members. That's what they've heard from their families that they represent across the province, Mr. Speaker, and that's currently the work undertaken by the health ministers today.
Hear, hear.
Recognize a member from South Fairview.
Mr. Speaker, when a Saskatchewan person is worried about cancer, there's no time to wait. The stress and anxiety on women and their families is immense. When you need a scan, you shouldn't have to wait weeks or months to access one. Right now, too many Saskatchewan patients are left in fear and without treatment. We're doing 10,000 fewer scans than we were before the pandemic. Why hasn't the number of scans recovered? And when will mammograms be running at full capacity again?
Recognize the Premier.
I think it's fair to say is the questions come across the floor, and fair questions they are today, Mr. Speaker. We have questions about our occupational therapy services in the province, Mr. Speaker. And what you see is a government that is taking immediate action, as well as looking to the future as to how we can provide those training services here at home, Mr. Speaker. As the Minister of Social Services became aware of an incident, Mr. Speaker, where a Saskatchewan individual was unfortunately removed from her home, Sask Housing home, Mr. Speaker, the Minister has taken action to look into that case, understanding that our Sask Housing units are often a home of last resort, Mr. Speaker, and to look into that particular case, Mr. Speaker. Here we see a very important conversation about breast cancer cancer in particular, Mr. Speaker, that has touched so many families in this province, Mr. Speaker. I've informed the House as to the action that the health ministers are taking on at the bequest of those very Saskatchewan families that have talked to many members of the government caucus, Mr. Speaker. Most certainly, we are looking actively at how we can increase those early detection services, Mr. Speaker, to accommodate what would ultimately be about 70,000 women that then could be provided that service, Mr. Speaker. This is a government that most certainly is always going to take action on behalf of the people that we represent across the province.
Sure.